Hi, my name is Joanna Garcia, and my partner Kalea and I are going to be talking about the piriformis muscle. So looking at the pictures presented on the slide, we can see that the piriformis originates from the anterior surface of the sacrum, as well as it inserts into the greater trochanter of the femur. Next, we are going to discuss the deep external rotators. So the deep 6 external rotators, also known as the deep 6, consists of the piriformis itself, the gemellus superior, the gemellus inferior, obturator internus, the obturator externus, and the quadratus femoris. These muscles all primarily insert into the greater trochanter of the femur, however, except for the obturator externus, which inserts into the trochanteric fossa. As mentioned before, the origin of the piriformis is from the anterior surface of the sacrum, while the other 5 from the deep 6 originate from various points on the ischium or the obturator foramen of the pelvis. Now we will talk about the 3 actions for this muscle. An isolated concentric contraction of the piriformis involves movement that shortens the muscle fibers while overcoming resistance. A concentric action for the piriformis depends on the hip's position and can cause external rotation, internal rotation, and abduction or abduction. Some examples for this concentric action includes a sideline clamshell, which you can use a resistance band for. This targets the piriformis's function as a hip abductor when the hip is flexed. The sideline position helps to isolate the piriformis and other deep hip rotators. Another example is a standing external rotation with a resistance band as well. You don't have to do a resistance band, but it just kind of works a little bit more. So this exercise targets the piriformis role as a hip external rotator in a weight-bearing functional position. Its controlling motion helps to isolate movement to the hip joint. Now, moving on to an integrated eccentric action for this muscle in particular refers to strengthening the muscle during its lengthening phase within functional multi-joint movement. Some actions include step-ups and step-downs, as well as controlled forward lunge. For the step-ups and step-downs, this eccentrically trains the piriformis and other hip stabilizers as you control your descent. These single-leg exercises replicate activities like climbing stairs and are effective for training eccentric control. Next, for the controlled forward lunge, this strengthens the piriformis by eccentrically controlling hip internal rotation and abduction as the leg moves forward and the hip flexes. Our last type of action is an integrated isometric action, which for the piriformis involves stabilizing the hip joint and pelvis during movements that primarily engage other muscles. Some examples for this isometric action includes a wall sit, which the piriformis isometrically stabilizes the hip and externally rotates the femur to maintain the correct alignment of the legs, especially if the knees are pressed slightly outwards. Another includes a bridge with external rotation. This targets the piriformis along with other hip and gluteal muscles to provide stability from a different. Next up is the primary antagonist to the piriformis, which are the muscles that perform the opposite hip movements. These include the anterior fibers of the gluteus medius, the gluteus minimus, the adductor magnus, and the pectineus, as well as the adductor brevis and longus. The gluteus medius, the anterior fibers of this muscle, help with hip internal rotation and abduction, opposing the piriformis's external rotation. For the gluteus minimus, this muscle works with the gluteus medius and other muscles to initiate medial rotation, acting as an antagonist to the piriformis. For the adductor magnus, this is a key antagonist for the piriformis for its external rotation function, allowing for hip abduction. Next is the pectineus, as well as the adductor brevis and longus. These are the strong hip adductors that act as the agonists when the piriformis performs abduction. Next up is testing. Specifically, we're going to talk about the range of motion testing. Range of motion tests for the piriformis muscle are performed by a healthcare professional to assess any muscle tightness and irritation of the sciatic nerve. This will often reveal any symptoms of piriformis syndrome. Some common tests include a seated position piriformis test and the FAIR test, which stands for flexion, adduction, and internal rotation. For the piriformis test in the seated position, the patient is seated upright and crosses the symptomatic leg over the unaffected knee, which is similar to a figure 4 position. For the action of it, the examiner applies a downward pressure on the crossed knee while the patient leans forward, or the examiner can push the knee towards the chest, stretching the piriformis muscle. For the FAIR test, which is the flexion, adduction, and internal rotation, the patient lies on their unaffected side with the upper hip and knee flexed to a 90-degree angle. The examiner passively moves the lower leg into adduction, which is across the body, and internal rotation. Now, if there's any pain in the buttock or posterior thigh, this could indicate a sciatic nerve irritation or compression by the piriformis muscle.
When discussing a manual muscle test for the piriformis, there actually isn't a specific muscle manual test that we can use that will isolate the piriformis. Instead, there are specialized tests that we can use to see if there's tightness within the piriformis and any pain or discomfort as well. Some of these tests include the FAIR test, which basically is the flexion, adduction, and internal rotation, the PACE test, the seated piriformis stretch test, and the active piriformis stretch, which is basically just going to be performed, and then through there we can see if the client is feeling any pain or discomfort throughout the test. And these tests are mostly just to see if the function is there and if the muscle is effective. Some stretches that isolate and lengthen the piriformis include the 4-point piriformis stretch, the knee to chest piriformis stretch, the supine piriformis stretch, and the cross-body piriformis stretch. These basically just help to decrease pain and discomfort, as well as improving the range of motion. These stretches also help to elongate and engage the tight muscle, which will eventually loosen up the muscle fibers. 3 of these can be performed while laying on your back and essentially pulling your knee close to your chest. The knee to chest one consists of having one leg over the other while being on your back and then pulling the leg that is underneath closest to your chest. The cross-body piriformis stretch is also on your back, which is basically just grabbing one foot with the opposite hand and then pulling it to that same side as your hand. And all of these stretches are going to be going until you feel a stretch within your piriformis and then holding it there for about 20 to 30 seconds and then releasing and then doing it on the opposite side. The 4-point piriformis stretch is basically like a pigeon stretch, but you're also going to hold it as well for 20 to 30 seconds and then release and do the other side. Some exercises that activate the piriformis include the clamshell exercise and the glute bridge. The clamshell exercise is when you lie on one side of your body with both knees and feet bent together. Then you lift the top knee away from the bottom knee and essentially squeeze your glutes, and you're going to keep repeating on one side and then flip to the other side and then repeat on that side as well. For the glute bridge, you're going to lie on your back while keeping your knees bent and shoulder width feet apart. And then you are going to keep your feet flat on the floor and then lift your hips up off the ground while squeezing your glutes at the top. Both of these exercises work to activate and strengthen the piriformis, as well as aiding in preventing injury to that muscle and as well as strengthening it. The piriformis plays an extremely important role in our everyday lives. While we're walking, the piriformis aids in hip abduction and external hip rotation, which means It helps move the leg away from the body and turning the leg outward. This allows for the weight from one leg to be shifted to the other leg and also allows there to be balance while walking. When we are climbing stairs, the piriformis helps to externally rotate the hip while also keeping balance and keeping the stability of the femur and hip joint. This ultimately allows the weight to be transferred as well as we are stepping upwards onto the stairs. A potential injury for the piriformis is the piriformis syndrome. This occurs when the piriformis muscle presses on the sciatic nerve, causing inflammation, pain, and numbness throughout that side of the body. The most common causes of this are inflammation in the piriformis, muscle spasms, and scarring in the muscle. These causes can happen from injuring the hip, sitting for long periods of time, over-exercising, and not warming up before physical activity. The piriformis syndrome usually goes away in a couple of days with rest and simple treatments, but it also is super uncommon to have. People sometimes get it confused between sciatica, but they are actually very different. Sciatica tends to have other nerves and muscles involved, while the piriformis just is the piriformis muscle and the sciatic nerve.